Good afternoon, everyone. Thank you so much for taking the time to join us today. My name is Melissa McVie, and I'm the Director of Communications with the Ontario Association of Residents' Councils. And today, OARC is so very pleased to be hosting guests from the Ministry of Long-Term Care on our Zoom platform to provide an information session for residents. Today's session, as you just heard, is being recorded, and I wanted to assure you that a copy of the recording will be made available following today's session, and it will be posted on OARC's website. After the presentation slides from today's session are translated into French, we will also include the links for the slides in both French and English on the website, along with that recording link. So please stay tuned for that. The information session today is being offered in a listen-only mode, and we're doing this in an effort to eliminate any background noises or distractions for our speakers. We have protected the second half of today's session time for an interactive question and answer period, at which time we will invite you to utilize the question and answer box on your toolbar to submit your questions. We will also be incorporating many of the questions that we received during your registrations, and look forward to having a mix of both. At this time, I would like to introduce OARC Board Director, Dorothy Asselstein, to begin our session with an Indigenous land acknowledgement.
Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today. From wherever we are virtually participating in today's meeting, let us take a moment to acknowledge the importance of the land we call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit and Métis and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us in our own way can move forward in a spirit of reconciliation and collaboration. Thank you.
Thank you so much, Dorothy. I wanted to also acknowledge Dorothy's presence here today. Dorothy is a retired nurse. She lives in Cornwall, and she brings to us today lived experience as both a resident and as a family care partner of a loved one living in long-term care. So I am assured that Dorothy will be an excellent ambassador, bringing forward resident questions during the question and answer portion of our time together. Pardon me. Just wanted to bring this slide up one more time and add one additional note that the chat box feature has been disabled at this time. We just wanted to eliminate any confusion and encourage people to use the question and answer for your questions. I also wanted to plug that we truly value your feedback. So we encourage you to take a moment to fill out the post webinar evaluation, and so we can integrate your thoughts and feedback for future sessions. At this time, I'd like to give a warm welcome to our ministry guests, beginning with Christine Lorio, who is the Director of Service System Planning and Operational Issues Branch, the Ministry of Long-Term Care. Welcome, Christine and team. We look forward to hearing from you today.
Great, thanks so much, Melissa. I'm pleased to be here today to provide an overview of the recent changes in pandemic response measures. As Melissa mentioned, my name is Christine Lorero, and I've been the director who's been leading, coordinating, and supporting the pandemic response efforts for the ministry for the last couple of years. Next slide, please. So today we'll be going through and providing an overview of the recent changes we made in the pandemic response measures. And at the end of the session, as Melissa noted, we'll have an opportunity to answer some of your questions. Next slide, please. By way of context, first I want to start off by acknowledging the sacrifice you've all made to protect your own health and safety and the health and safety of those you live with and who work with you in your long-term care home. It's thanks to this collective commitment and sacrifice over the past 3 years that we've now been able to wind down some of the measures that have been in place for quite some time. The challenging respiratory season, which saw the return of other respiratory illnesses like the flu on top of COVID, is behind us now, but we do expect that COVID will continue to fluctuate around the current levels, and we'll see some increased activity or ripples throughout the year, which is different from the flu, which usually we see increases over the fall and winter. But having said that, given the high uptake of vaccine amongst residents and access to therapeutics, as well as high levels of immunity at the broader community level, the risk of severe outcomes to residents has been significantly reduced. Next slide, please. And that's why the ministry has worked really closely with the Office of the Chief Medical Officer of Health to make changes to the COVID response measures to ensure that they are appropriate at this point in time in the pandemic. So the next few slides are going to go through what some of those recent changes were. Next slide, please. So for masking is still required indoors at all times for all staff and visitors that enter a long-term care home. Visitors and caregivers may remove their mask if they're with a resident in their room or in another designated space, provided no other staff or residents are in that space. When outdoors, masking is no longer recommended for visitors or residents, except we are recommending it for staff who are in close proximity to residents. Next slide, please. For testing, rapid testing, or what we've called asymptomatic testing, is no longer required for staff or visitors or caregivers entering the long-term care home. Some homes may choose to maintain this, but it's not recommended by the ministry at this time. It's important to note that this is different from symptomatic testing or testing when you have symptoms of COVID. Testing when you have symptoms will continue, as that's an important part to ensure the right treatment and to contain and manage outbreaks. Next slide, please. The process of screening for symptoms or exposures before entering a long-term care home will shift from an active process, which previously required staff to verify screening, to a self-monitoring process where staff and visitors self-monitor for symptoms before entering a long-term care home. This is also known as passive screening. Homes are required to have appropriate signage and to communicate with staff and the home's family and visitor community to ensure people know how to self-monitor and to not come to the home when they are sick. Next slide, please. Another screening-related change, requirements specific to daily temperature checks have been removed, as temperature isn't the best indicator of possible COVID infection among residents. However, homes are still required to assess residents daily for signs of infection of any type, not just specific to COVID. Also, residents will no longer need to be specifically screened for symptoms of COVID when returning from an absence. Next slide, please. For visitor access during outbreaks, homes must still follow guidance and direction from their local public health unit, which may include restricting access for general visitors. However, caregivers will continue to have access to residents even during an outbreak. The ministry removed the limit of one caregiver at a time during an outbreak. So that is one of the recent changes that we have made. Public health units or homes may have their own policies on number of caregivers at a time based on the specific circumstances of the home or of the outbreak. Next slide, please. Homes can now hold activities without adjusting for physical distancing and can structure their activities based on their individual home circumstances, staffing, and resident population. Next slide. Vaccination. So vaccination continues to be a critical layer of protection against COVID-19 It has greatly reduced the risk of serious illness, and the ministry continues to encourage all residents, staff, and visitors to stay up to date with their vaccines. Having said that, the ministry is encouraging homes that currently have proof of vaccination requirements to reassess their policies in the current context of the pandemic and with consideration of the Resident Bill of Rights, and to do so in consultation with their resident council, their family council, their local public health unit, and their legal counsel. Also, the Ministry of Health recently announced a spring booster campaign, which recommends that those at higher risk of serious illness, including residents living in long-term care homes, to receive a booster if they haven't received one in the past 6 months. So just in terms of implementation, these changes to ministry requirements came into effect on March 31st, although we recognize that some homes might need some time to adjust their policies. So that's been the overview of the recent pandemic changes, and I'm going to be turning it over to Lori Coleman to give the update on the recent regulation changes.
Thanks, Christine. And good afternoon and a warm welcome to everybody. My name's Lori Coleman, and I'm the director in the response branch at the Policy Division of the Ministry of Long-Term Care. And it's my pleasure to have the opportunity to connect with you today to talk a little bit about some changes to the laws that have come into place over the course of the past week, and to talk a little bit about how that might impact residents, their families and caregivers, and certainly to answer any questions that you might have about the new rules that have come into place. No doubt you've got questions also for Christine with respect to the presentation you've just heard. So again, I would encourage people who didn't have an opportunity to send questions ahead of today's meeting to put them into that Q&A area of the Zoom call, and we'll do our very best to answer those at the end of the presentation. So if you could advance the slide, please. I want to talk a little bit about why we're here today, because our key purpose in connecting with all of you is to talk about the new regulations for long-term care homes in Ontario, and to talk more about what it means and how what you might expect to see in your homes across Ontario. You can move to the next slide, thank you. On April 11th, the ministry made some changes to the rules that long-term care homes need to follow. And some of you might recall that right around this time last year, it was actually April 11th of 2022, that a new act came into place to set rules for long-term care homes across Ontario, and that was called the Fixing Long-Term Care Act. And since April 11th of last year, we heard from different areas, and sometimes we heard from staff, sometimes we heard from residents and family members and caregivers, sometimes from organizations that are advocacy groups or professional associations, about ways that we could continue to improve the rules in long-term care to make operations and oversight of homes run more smoothly and ultimately result in a better quality of care and quality of life for residents. Now, the regulation changes that took place just last week on April 11th, they were really focused in about 3 different key areas. The first was with respect to medication management and some very important components in how residents safely receive medications. And we're going to talk about that a little bit more in the presentation today. There were also elements that related to staffing in long-term care and the requirements for some of the staff positions. And then also some general rule changes that serve to ensure that residents live comfortably in their homes. We'll move to the next slide. So the ministry remains extremely committed to ensuring that long-term care residents all across the province receive the best possible care and enjoy a high quality of life. And our role in this really means making sure that the rules in long-term care homes have to put resident safety first and need to support homes to deliver quality care. And we know that needs change, they evolve over time. And so we always welcome input from anyone, residents, families, stakeholders, about how we can improve rules within homes. With the support of the Ontario Association of Residence Councils, we were able to connect earlier this year with a group of resident leaders. And I know we've got Dorothy on the line today. Dorothy, it's nice to be connected with you again. In a small focus group where we talked a lot about medication management and about different resident experiences. And that input really helped us to shape the rules that we were looking to update within long-term care. We'll move to the next slide now. And I'm going to spend a little bit of time talking about the changes to the rules that relate to drug administration or medication administration. So the ministry is working to modernize drug administration requirements so that more health practitioners can administer drugs to their full scope of practice. If we go back to before the pandemic, there was a limitation in which health professionals could administer medications to residents in long-term care. And it was only doctors, nurses, and dentists that were allowed to do that. And throughout the pandemic, there were some special rules that allowed for greater flexibility in who could administer medications to residents. And feedback that we've received across the province has been that in homes where they had more health practitioners supporting medication administration, that it could work really well. And so one example I'll use to highlight this particular piece relates to the benefits of changing the rules. The change in rules now allows pharmacists to administer COVID-19 and flu shots to residents in long-term care homes. So pharmacists have been allowed to do that in the community, in their local community pharmacies. The extension of the rules to allow health practitioners to practice to their full scope of practice means that pharmacists can do that in your homes as well. Another piece of the change to the rules is that at a home's discretion, personal support workers can administer drugs if there are a number of different conditions that have been met, including having received training and following some very specific rules. And I'll give an example of this one as well. So on the direction of a nurse, with the change in these rules, a personal support worker could assist a resident with eating applesauce that has tablets or medication crushed into it. And these changes really align with what personal support workers are able to do in other care settings like retirement homes. And again, I want to underscore that there are some really important safety precautions that have been included in the changes to the rules that specify what a personal support worker can and cannot do in administering medication for residents. It's also important to acknowledge that not all homes will decide that they are going to have their personal support workers administer medications to residents. The rule change does not mean in any way that only personal support workers will administer medication for residents. What the change does mean is that a home who wants to include personal support workers in medication administration can, as long as they follow these rules. They include things like personal support workers are not allowed to administer medication if it involves a controlled act. And an example of that is that a personal support worker will not be allowed to give any resident an injection like insulin because injections are a controlled act. And similarly, personal support workers are not allowed to administer medication if it involves a controlled substance. And that would include medications like opioids and narcotics. Now, with respect to training, In addition to the training that personal support workers receive in their education programs as they're studying to become a personal support worker, homes are going to need to provide training to personal support workers in addition to that standard training that they go through as part of their education. And again, what we've heard is that there are some homes that have been already working with personal support workers and developing training, and it's been working very well in many, many instances. And certainly all of the elements that we've included in the rules are designed to help ensure that resident safety remains focal. The last piece I want to highlight on this slide before we move to the next is that the regulation now requires long-term care homes to offer COVID-19 vaccines to residents, just like they do the flu shot. So it doesn't mean that residents have to have a COVID-19 vaccine, but instead it clarifies for homes that they have to offer all residents with an opportunity to receive a COVID-19 vaccine if they so choose. So we'll move on to the next slide. And a few more pieces with respect to medication management. Some of the additions to the new rules are really targeted at bolstering resident safety. And these ones look a little bit more on the very front end as a resident joins a long-term care community. And so with the changes, every new admission to a home, a resident's admission care plan is going to need to include not only the medications that a resident is taking, but also the reason why they're taking a medication. What we've learned is that there would be a lot of benefit in understanding the why behind why medications are taken. And an example of that might be something as straightforward as aspirin, which can be prescribed for lots of different reasons. And if a home's able to understand the reason why, then it can make a real difference to how care is provided. So that's been included as a rule. Also, at the time of admission, any known adverse drug allergies or reactions are to be identified within the admission care plan. And then beyond that admission care plan, a thorough evaluation of all medications is going to be required to ensure the safety and effectiveness of taking them for every resident. And these changes serve, again, to protect residents by giving clinicians and registered staff at long-term care homes a better understanding of each resident's medication needs as early as possible. Next slide, please. All right, so with regards to staffing qualifications, we've heard throughout conversation over the past many years that homes, residents, and families we're asking for there to be different ways to ensure that homes have staffing teams that are able to be really well positioned to provide the best quality of care and life for residents. And so within the rules, there were very specific qualifications for a number of different roles in a long-term care home. And we took a close look to make sure that there was no unintentional barriers to retaining staff and made some changes that help support more flexibility for homes to hire and retain qualified candidates as staff. And the positions range, and they include things right down to the food service workers who support meal development and delivery within homes. And these changes are intended to balance staffing flexibility needs for a home while maintaining resident safety and quality of life. We'll move on to the next slide. So a little bit more generally here around resident experience, there were a few changes that we made to the regulation. And the first one is that homes are now required to always complete a post-fall assessment when a resident falls. And under the previous rules, there was a bit of discretion on when a post-fall assessment would be completed. This clarifies for homes that a post-fall assessment will always be completed. There's also a clarification with respect to assessment by a registered dietitian in circumstances where a resident has exhibited a skin condition. And it's clarifying that that assessment will be undertaken when the condition is likely to respond to nutrition intervention. We'll move to the next slide and some pieces about air conditioning. While the vast majority of homes across Ontario now provide air conditioning in resident rooms, to further enhance the resident experience and ensure that homes continue to be accountable, the ministry has introduced a new penalty of $25,000 for homes that fail to have air conditioning in every resident room and designated cooling area between May 15th and September 15th of each year. The regulation also makes clear the type of air conditioning systems that homes are permitted to install. And it also adds a clarification around removal of portable or window air conditioners. That we had a number of questions over the course of the past year around when a home would be allowed to remove a portable air conditioner and still meet the requirements to have air conditioning within the home. And so we've worked to clarify that within the rules now. And on the next slide, with respect to alternative level of care, the ministry's made some changes. And again, these are serving to try and clarify the rules with respect to alternate level of care placements in long-term care. And so for those of you who may not be familiar, alternate level of care patients are those who are in hospital, but where their care team has indicated that there might be another setting where their needs might be better met. And sometimes that setting is identified as long-term care. And the regulation changes are serving to make it clear that a placement coordinator can place an alternative level of care patient who's only requested a basic room, that they can place them into a private or semi-private room at just the basic rate. It also clarifies that a resident who was previously an alternate level of care patient in a hospital and who has been moved into a private or semi-private room can only be asked to pay the preferred rate if they choose to stay in that room or if they refuse an offer to transfer into a basic accommodation room if one becomes available. And we'll move to the next slide. It really takes me to the very end of our prepared presentation for you. And but I wanted to reiterate that the ministry is really looking to continue dialogue with residents, with families, with all important stakeholders to continue to tell us what's important with respect to rules that are in place and how we might look to continuously improve them in the future. So I know we've preserved time. Hopefully I think we've got about a half an hour left. And we're going to use this opportunity now to take questions. And I know some of you have submitted questions in advance. And I think, Dorothy, you're going to help me work our way through some questions that were received in advance. And I'm going to do a quick check here to see if there are questions coming into the Q&A on the Zoom call. So bear with me for just 1 second.
Thanks, Lori. Perhaps we could put Dorothy in the hot seat first to queue up our very first question. And we did try to group the questions by theme as they came in through our registration system, but we might be kind of going in and out of order. So Dorothy, do you have a question you'd like to pose to the ministry team?
Yes, I do. The very first question has to do with medication administration by PSWs. So can a resident or their substitute decision maker specifically ask that a nurse administer medications if they are not comfortable with a PSW doing it?
And I'm happy to field that one, Dorothy. As you know, this topic is near and dear to my heart. This is an area where you and I have chatted before. This is a piece that we've definitely heard from a number of different areas as a key question. And so I think at any time that a resident or their substitute decision maker wishes to have specific pieces of service or connection points within their home, they can always talk to their care team at their home to make those requests. A piece that I forgot to mention in my earlier delivery is that the ministry is developing a guideline that will help homes that are updating their policies and procedures within their homes to help guide and support personal support workers who are going to be supporting medication administration. So again, our best advice on this is always for residents and their families and caregivers to connect with the care team at their home if they have any concerns about medication administration. And so I hope that answers the question, Dorothy. And I'll take you out of the hot seat for a moment so that you can be ready with your next question. And while you're queuing your next question, Dorothy, I'm going to pose one to my colleague, Christine. This is a question that's come in through the live chat. And Christine, the question is, should residents coming from hospitals be tested and isolated for a period of time?
Thank you, Lori, and thanks for the question. Currently, according to the Ministry of Health guidance that's provided to public health units and shared with long-term care homes, there is no requirement for residents coming from hospitals to be tested or isolated unless they're showing symptoms of COVID-19 or of another illness, in which case they would be tested and isolated. So just to clarify, there's no requirement for testing and isolation for residents coming from hospital unless they're showing symptoms. And there's also a process in place if they are coming in from a hospital that's currently an outbreak for the home to be working with their public health unit to make sure that's done in as safe a way as possible. Thank you.
That's great. Thanks, Christine. Dorothy, I'm going to turn it back to you if that's okay, if you've got another question queued and ready.
Well, I do have another question along the lines of medication, or did you want to open up a different subject?
No, I'm happy to take your medication question.
Okay, so the medication, will there be some kind of standardized education and training for PSWs to qualify them to administer medications in long-term care medications? Who would oversee this?
That's a great question, and certainly an important one. So I've got a couple of different ways to tackle the response. So there is curriculum requirements that are established for personal support worker programs across Ontario. And there are standards that have to be filled for what's included in the curriculum. And a part of that does include drug administration. It's not specified to drug administration in long-term care, it's broadly drug administration. So that's the first part of the answer, to say that as personal support workers are moving through their education, there is a component that ties into medication management and drug administration. Now, flipping over to the more narrow long-term care home context, homes will need to update their policies and procedures, and that's a firm rule that's in the regulation. And those policies and procedures are going to need to describe what the medication administration practices are in the particular home. And another piece that the ministry is developing and expects to be providing to homes at the very beginning of next month is a guidance document or a guideline for homes that will help them to build a training program for the personal support workers that are working in their home, if the home chooses to have those personal support workers supporting medication administration within the home. So it's a bit of a twofold response. Yes, there's a piece as they're going through their education program, but then there is a further requirement for homes to provide specific training to their staff team within. So that was a great question, Dorothy. Thank you.
Well, thank you. That was a great answer.
All right, I'm going to pick up the next question, Dorothy, while you find your next question. I can see another one coming through the live chat. So Amanda, and Ashley, I might be stealing one of yours, Dorothy, I'm not sure, but Amanda, I'm going to send this one your way. It relates to staffing. Can you please provide an update on the amount of time being spent with each resident each day?
Definitely. Thanks, Lori, for the question. So the ministry is committed to supporting increased direct care time for residents in long-term care homes. There are rules that are actually in law in the legislation that governs long-term care in the province that sets out a system level average target of 4 hours of direct care per resident per day by nurses and PSWs, and that target is to be achieved by the end of March 2025. And there's also another target in there for an average of 36 minutes per resident per day by allied health professionals. So that would be people like resident support aides, social workers, physiotherapists, etc. And that is to be achieved by March 31st, 2023. So just a few weeks back. In order to support this target and support homes in achieving these targets, the government has provided this year $1.25 billion to homes to help hire more staff. And I'm happy to report that, as communicated last month, we can say that Ontario has successfully achieved our first provincial average direct care target for the 2021-22 year, which was for 3 hours, and then 33 minutes for allied health professionals. So we've hit the first year one milestone. We're just collecting the data from homes now to see how we're doing on the year 2 milestone. That's going to eventually get us to 4 hours per resident per day for nurses and PSWs and 36 minutes with allied health professionals. Thanks, Lori.
That's great. Thanks, Amanda. Okay, Dorothy, I'm going to turn it back to you, and I'm okay if it's on medication management or if your question's on any of the other topics that you might have.
Well, there is one little question left on medication that I have.
Okay.
And it is kind of important. Will there be a list of high-risk medications identified that only nursing staff will be permitted to administer?
That's another important question. And yes, so one of the rules that's included in the regulation is that personal support workers will not be permitted to administer controlled substances. And there's a very long list of controlled substances that's governed by the Controlled Substances Act in Canada, and it's very lengthy. So certainly that's a hard and fast rule that none of the drugs that are listed in the Controlled Act can be administered by a personal support worker. But perhaps a little bit more straightforward than that, we've got a really great partnership with an organization called the Institute for Safe Medication Practices in Canada, or ISMP Canada. And they've got a best practice guideline with respect to high alert medications. And we will certainly be including that in the guideline document that we are developing for long-term care homes. I can tell you that it's a little bit easier to synthesize than that very long list that's included in the Controlled Substances Act. But absolutely, there are firm rules around the medications that a personal support worker is not allowed to administer to residents in long-term care. Okay, so I'll flip over and take a look at what's coming in to the live chat before I turn it back to you, Dorothy. So the next question, it looks like, is for Andre, and it relates to post-fall assessments. So Andre, the question is, what if a resident won't or has challenges in staying in a chair or a bed and they fall several times a day? How often will the post-fall assessment be done and what's involved?
Thanks for the question, Lori, and from the resident who submitted that. My name is Andre Trevisan. I'm here from the ministry. I can't speak to the full aspect of this question, but I'll do my best. So first and foremost, anytime a resident falls, according to the new rules, a post-fall assessment must be conducted. So if the resident unfortunately falls several times a day, every time they fall, one of the attending staff will have to conduct that assessment. In terms of what the assessment entails, so what the legislation requires, what the rules are, is that they need to conduct the assessment using a clinically appropriate assessment tool specifically designed for falls. So the regulation doesn't say what assessment tool specifically has to be used, only that it's something clinically accepted. So I think if you have questions about the assessment tool being used, you should talk to your healthcare team in the long-term care home and ask them for more information on the types of things to look at in that assessment.
Thank you, Andre. Okay, Dorothy, I'm going to hand it back to you while I look for the next online question. Did you have another question, Dorothy?
Yes, I do. And it kind of relates to the summer that we're hoping is coming. My understanding is that homes are now required to have air conditioning in every resident room. Now, supposing personally you didn't want air conditioning in your room, you found it was too cold, how will my comfort preferences be considered with these new requirements?
Thank you for the question, Dorothy. My name is Anita Hooper, and I'm with the Operational Policy and Implementation Branch here at the Ministry of Long-Term Care. And so since last summer, all long-term care homes have been required to have the capacity to provide air conditioning in all resident rooms. So we, at present, homes, about 95% of all homes are fully air conditioned. So they've worked really hard to get there. The regulation doesn't set out a specific temperature that homes need to meet with air conditioning, but rather what it says is that the air conditioning has to maintain the temperature at a comfortable level for residents, and that this will vary based on resident preference and needs. So one thing we have to consider is that some homes have central air conditioning and some homes have portable and or window air conditioning units. So depending on the type of air conditioning, it may be possible to adjust the temperature in every room. However, in some homes, the temperature may be adjusted for different areas of the home. But what we would recommend is that residents continue to talk to their homes if they're uncomfortable about the temperature, and that's the summer and the winter. So one of the things that you raised is really important. And so based on feedback that we've received since the regulation changed last year and in consultation as we came up to this most recent regulatory change. And so as of last week, the regulation now says that portable and window air conditioning units may be removed at the request of residents. The regulation specifically outlines when a unit can be uninstalled. And so that can be either at the request of the resident, or if the licensee needs to do that in order to store it or to maintain it. So if it's a request by the resident and the licensee is satisfied that it's feasible to do it, so it's not unsafe to remove it or something else that we haven't considered, it can be removed as long as there's not another resident in the room who wants the air conditioning there. So everybody needs to consent that that's what is wanted for that particular room. So some new changes related to air conditioning based on some really great feedback that we got. So I really appreciate the question. Thank you.
Thanks, Anita. So the next question coming in through the live Zoom call is, are residents being told their PSW will be able to give them medications? And so that one, I'm happy to respond to that one as well. What I want to highlight again is that not every home will choose to have personal support workers administering medication in their home. Some homes may have systems in place that are working very well, and they may choose not to change their procedures in any way. Homes that do decide that they want to have personal support workers helping with medication administration are going to need to update their home's medication management practices and procedures, their written documents. And I think while the notification to residents might look different in different homes, I think residents are always in a position to ask homes about the policies and procedures that they have in place for any of the services or programs that are provided to them. So it's difficult to answer whether or how a home might communicate to residents, because it might look a little bit different in all of the homes. But that being said, certainly the policies and procedures that are in place in any home are available for residents at any time. Another piece that we are looking at including in the guideline that we're using for homes or developing for homes that we expect to provide next month is that homes will want to consider how they engage their resident council to inform them of these types of policies and procedures. And so there may be a conduit through that council as well for updating residents. So that's not a super clear answer for everybody. I think it may vary by home, but it's a great question. And with that, Dorothy, I'm going to turn to you for a next question coming in.
Okay. So the next question is, are there any plans to revisit masking requirements for long-term care team members and visitors? Some of us are longing to see the faces of our caregivers.
Thank you, Dorothy, for the question. Christine here. I'm happy to answer that question. So in the most recent round of changes, the advice we received from our public health experts was that masking is still a very important layer of protection in long-term care homes. We did a few months ago add the exception. So if you're kind of one-on-one in your room with your loved one, your visitor can remove their mask, or if you're in another designated space in the home, which might be particularly important for those who are in shared rooms. But generally speaking, if you're in communal areas around the home, visitors will need to wear their masks. Having said that, that is something that we are currently talking to our public health experts about. Like, what does masking look like longer term in long-term care homes, especially if we are in periods of lower COVID transmission? So it is something we're having active conversations on. We know, and we've heard from you and other residents how important it is to be able to see the faces of your loved ones, to be able to share a meal and celebrate various holidays and milestone birthdays with your loved ones. So it is something we are actively having conversations about, and hope that we can have some updates for you in the near future. Thank you for the question, Dorothy.
Thank you.
Thanks, Christine. Kelsey, I'm going to direct the next question to you. And the question is, how is the government improving resources to stay in your own home?
Thank you so much for this question, and I appreciate that this is not a question that is specific to the regulations and legislations that we came here to talk to you about today, but it does point a finger to some important work that's happening in the ministry. I can't speak to everything that the government is doing with regards to encouraging and supporting individuals for staying in their own home, but I can tell you about a program that the Ministry of Long-Term Care has been implementing since 2020, and that is the Community Paramedicine for Long-Term Care program. So what is the Community Paramedicine for Long-Term Care program? It is a program that uses paramedics in a non-emergency capacity to provide support for people in their own homes. So this is a model of home care that works with traditional home and community care, that works with primary care providers and other community partners to supplement the care that's provided in their own home. This includes 24-hour, 7-day-a-week access to paramedic services for non-emergency procedures in the home, responsive, prompt, flexible responses to changing conditions or circumstances or medical conditions if necessary, being proactive to routinely monitor, sometimes remotely, to prevent an emergency incident or escalation of a medical condition. And it allows in certain circumstances under the supervision of a physician, certain diagnostic procedures and treatments to be provided for individuals in their own home. Who is eligible for community paramedicine for long-term care are individuals that are currently on the long-term care wait list. Those who, because we recognize and appreciate that those people might have a number of months to wait before they are placed in a home. Those who have been assessed as eligible for long-term care and have not yet been put on the wait list, or those who are deemed soon to be eligible for long-term care. So the idea is really to help stabilize individuals, avoid hospital visits, unnecessary emergency room visits, and give caregivers and individuals peace of mind that they have a number to call in the event that they require assistance or change in their circumstances. And my apologies, I should have said at the beginning, my name is Kelsey Gershon, and I'm the Director of the Policy and Modernization Branch at the Ministry of Long-Term Care.
Thank you very much, Kelsey. Dorothy, do you have questions that are left on your list to pose?
Well, I have one that's still on my list.
Yeah, let's do that next.
Okay, it's called a bonus question.
Okay.
Is there an expectation at the ministry that the proposed changes, including those reviewed today, will be discussed with residents' councils in every long-term care home? And how would the ministry ensure that this is happening?
I think it's a great question. And do you know, I think it might vary by home. There's no, I can tell you there's no requirement under the law for that to happen. So under the rules, there's no requirement, but from everything that we understand about the operations of resident councils across all long-term care homes, they're playing such a vital component in contributing to the ongoing improvements in how care and services are provided in long-term care. So certainly having dialogue around how changes or what the changes are may be helpful at the resident council forum. What we do have is, and we'll make sure that it's provided with materials. I think Melissa mentioned earlier that the slide deck that we went through earlier, that we still have up on the screen right now, actually, and as well as an information sheet that outlines what residents can expect from these changes, will certainly be made available to residents' councils at their request. And so I'm hoping that those can help to inform participants on residents' councils, and then even more broadly to all residents.
Thanks for mentioning that, Lori. I was actually just thinking it might be helpful if we also link the what residents can expect document for the pandemic response and with the regulation updates, because there's two visuals that really is a nice snapshot of the changes, and it might serve as a great launching pad for some excellent discussion at the resident council level, and that might prompt councils to consider inviting guest speakers from their long-term care home leadership to have some in-depth conversations about some of the themes we touched on today and how it might have direct impact on resident quality of life and resident experience. So thanks, Dorothy, for throwing that question in there. We've really tried, we've had a steady stream of questions coming in today, and we've really tried to prioritize the questions that came from residents as today's primary audience being intended for residents and resident councils. And so we will I think have time for maybe one or two more. Lori, I'll leave it to your discretion. I think Dorothy.
Yeah, I think we've got a last few here, and we might be able to answer them quickly. So there is a question here that relates to non-registered staff and permissions for administering medication, and very specifically topical medications. And so we'll be short and sweet with the answer. The application of topical medications right now, that is at the direction of a nurse, and that will continue. So the personal support workers who are supporting medication administration will continue to work at the direction and with support from nursing staff. So hopefully that clarifies that. There's a quick question here that's for my colleague Anita, and it's looking for a little bit of clarification on the rate of pay for alternate level of care patients, and just wanting to clarify that piece around is if that's only with respect to a private room availability at the time of admission. So Anita, are you able to clarify for us?
I sure am, and that is exactly correct. So the ministry reimburses homes for the cost difference between the preferred and basic accommodation. So this only happens when the placement into preferred. So first of all, it's intended to be temporary while a basic accommodation becomes available. And the basic accommodation, only basic accommodation, has been requested by the ALC patient or selected by the placement coordinator. And there is no basic accommodation available at any of the homes requested by the patient or selected by the placement coordinator. So that's correct. Thank you.
Thanks, Anita. And I wish we could have gotten to absolutely every question. I don't think that we did get to everybody's, but we do have an email address that we have up on the screen, and we would certainly welcome any questions or any comments that we didn't get to today. I really want to thank our valuable partners at Ontario Association of Residents Councils for bringing us together with you today, and to everybody for your time. We had a lot of people on the line, and it was very nice to connect. So Melissa, thank you so much to you and your team.
Thank you, everyone. And on behalf of the residents across the province and OARC, we really look forward to continuing this conversation, continuing our partnership with ministry, and above and beyond contacting ministry directly using that email. We welcome residents to reach out with us on an ongoing basis. Please stay connected with us through our weekly resident forums. It's a great way for us to learn what's important to residents and what we can really help, what messages we can amplify, and what we can bring to our ministry partners for further conversation and future webinars. So wishing everyone a wonderful afternoon. I will request once again that you do take a moment to fill out the post-webinar evaluation to give us some feedback on today's session and to inform some future planning. And a reminder that we will circulate the recording to everyone who registered. So if you have fellow residents or colleagues who might have missed today's session, you are welcome to share the recording and watch it at a later time. And we will be sharing what residents can expect handouts and the slide decks when they are available, and posting them on the OARC website. So thank you again, everyone. Have a lovely afternoon and stay well.
Thank you.
Bye-bye.
Bye.
And thank you, Dorothy. You're wonderful.
Oh, you're very welcome. Thank you for all the work.
I I missed acknowledging you, but you really were a welcome addition to our team today. So thank you.
Well, thank you.